Three, two.
All right, we're going to get into some things today. So I'm prepared. I have my questions written down.
Okay.
And I'm going to start with question number one. New York recently, New York recently made a mandate that all healthcare workers have to be vaccinated. Does this include yourself?
Absolutely. I am a medical professional. We are actually on the front lines of defense. As a healthcare professional, as well as individuals that deal with patients, children, in general, those people are responsible for their clients, and they should be vaccinated for the protection of those clients.
Right. So are you also enforcing your employers to follow through with the new vaccine mandate as well?
Uh, we don't have a choice as healthcare practitioners in New York State. The governor has mandated that all healthcare practitioners, all state workers, all federal workers, all Department of Education employees be vaccinated by a certain date. That date keeps moving around because of lawsuits, et cetera, et cetera. But as of the 27th of September, it was pretty much a firm date for Department of Education employees and hospital workers and nursing home workers. Home health care providers, we have until October 7th to get our first vaccine. My employees have to have their vaccine or they won't work.
Right. And is that because, well, the majority of you guys' clients are children, like you said, from ages 0 to 3. So we know that children, the vaccine hasn't been made available for them. So is that another reason as to why you're pro-vax for your employees?
I'm pro-vax for the employees just in general, just for the community itself, the community at large. We have to protect the community at large. The only way to protect the community at large is to vaccinate the community at large. There was a time when we didn't have a vaccination and there was nothing but death in the streets of New York. So we want to eliminate that happening again, and we've been able to do that by getting the vaccine.
Right.
Yeah, definitely.
So the media and my favorite doctors, Dr. Fauci, Dr. Gupta, and Osterholm, right? They've been having bits of contradicting information for over the last year. Now, do you think that that's because things change, science changes, or do you think that it's a form of TV programming and, telling the people kind of what we want to hear or what we need to hear to keep the world in less of a panic?
My opinion is it's a combination of all of those things that you just said. Does science change? Yes. Are we in the middle of the pandemic? No. We're still in the beginning of the pandemic. Therefore, we are still learning everything about COVID. We're only, what is it, a year and a half? A year and a half into COVID, really. So when your favorite doctors come on TV and try to give us guidance on what we should be doing as a community and how to deal with COVID, remember in the beginning, or when Trump was in power, he pretty much stifled the doctors. He pretty much banished them from the stage for a whole 6 to 8 months. I mean, he was running things, right? But when you get the doctors on TV and they try to give us the guidance, they're trying to give us the guidance that is accurate at the time. So as things change, they give us updates because nothing is set in stone. Everything is in motion.
So with that being said, can you really shame or blame people that just aren't comfortable with committing to something like that because they understand that, okay, it's still in its early stages and we're all still learning. And what may not kill you now, we don't know the effects that it'll have 10 years from now, you know? Can we really shame people or discourage them for not jumping the gun and following suit?
I don't think you should shame people for having a choice in the matter, but people do need to look at the basics. The basics are we were dying, at the beginning of COVID. Now we're not. The reason why we're not is because of the vaccine. So to make the choice of not taking the vaccine, are you willingly choosing death over what could happen in the future? So for example, every vaccine has this period. Right now, the COVID vaccine, we're in the beginning of a vaccine stage. The measles had a beginning. People didn't want to take the measles vaccine, but we eradicated measles. The mumps, same thing. Varicella, which is chickenpox, same thing. Now you can't get a job without the measles, mumps, and rubella vaccine. So everybody has to take it, right? You can't go to school without it. Everybody has to take those vaccines. So this is kind of the same thing. People are going to rebel in the beginning. In another 5 years, yes, it's going to be mandated. Or else what? We have to go back into lockdown because people are getting COVID again. And then it changes from Delta to Mu to Lambda or whatever else. And then what? We're back to square one.
Exactly, but that's the thing is that with those vaccines, like the chickenpox and the measles, right?
Mm-hmm.
I don't think people have a problem with getting those because you get that shot and then you know that you're good for a certain amount of years to get the shot again, and then you know that you're not going to contract that virus.
That's not true, because you have to get a booster for those vaccines as well.
Okay.
So it doesn't last forever.
Right.
Nothing we have, I don't think, lasts forever. Including the flu vaccine. We have to take a shot every year for the flu because the flu mutates. Right now, the COVID vaccine is still new. We're lucky to have it this early. People really forget. I mean, as a medical professional, I was out there on the front lines. I saw it. I was in New York City, which was the epicenter. Here in Los Angeles, like I was, mentioning before, you guys are kind of the frogs in the pot of water.
The frogs in the hot water. Can you please explain to them what exactly you meant by that? Because I was fascinated when you explained it earlier.
So the story of the frog in the pot of water goes like this. If you put a frog in a pot of hot water, the frog will jump out of the water immediately because it's hot. If you put a frog in a pot of cool water, the frog will sit in the cool water. You turn up the stove, and you can boil the frog gradually. The frog will not jump out of the water. So here in Los Angeles, I say that you guys are in the pot of water and you guys are the frog because here, at one point, there was no virus. Everybody was happy. You were looking in the news and you saw New York over there, way over there on the other side of the world, having these problems. We're over here in California, we're safe. It's not coming here. So gradually, people started getting COVID. And right now, Los Angeles is the #1 county in the country with COVID cases. You have 1.4 million COVID cases. And you're also leading the category in deaths. But they don't talk about that here. 22,000 deaths, which is leading the counties. Every county in the United States, Los Angeles is #1 in death.
But I'm glad that you have brought that up because there's a difference in the environment. There's a difference in the air of just living in New York and living in LA. New York is very condensed. And I was there. I lived there at the beginning of the epidemic, or the pandemic. I was there. I lived there. And I've been back to visit a couple times, and I've spoken to people on the trains. Mm-hmm. And some have made it very clear that they don't think the public transportation system is ever going to be safe with COVID. What do you think about that? The people that have to commute every day to go to work.
Well, I'm going to go back to the beginning of your statement. So Los Angeles is not safe. Nowhere is really safe. And I'm going to go back to the beginning of COVID again. When the big cities were getting hit with COVID, and the Middle East, the Midwestern states were not, the southern states were not. That's why they left their counties open. They didn't close. They didn't mask. When the second and third wave came, that's when it hit them. Some of them decided to close and mask. Some of them didn't. Florida, as you know, DeSantis, he's still wherever he is, He has
They were partying. They were spring breaking for at least 2 months.
Absolutely. And all of the holidays and spring breaks, they did everything, and then their numbers went where? They didn't stay plateau. They didn't go down. They went like this. There was a spike. So even here in Los Angeles, like now, even before, like I said, there was no cases out here. Now you're leading the country in COVID. I mean, it's not something that's talked about. Like I was out today, in the restaurants, people didn't have masks on. It just felt normal, right? But your governor did mention that there's now going to be a mandate.
Right, right. So I was in New York when the mandate started. I was in New York when the mandate started for you have to have your vaccination card to be in any public setting indoors. And I was I guess I was taken aback by it because I remember even like Nancy Pelosi. I remember Joe Biden. I remember people in the Senate speaking and saying that they would never make the vaccine mandatory or they would never make it a requirement and that it would be unconstitutional for them to do that. So why do you think now the gears have shifted?
I think you're giving too much credit to politicians and what politicians say and when they say it. And, they say things at certain times for certain reasons. A lot of times the politicians will say things to pacify us. They give us the information that we need at that time. And then when things change, they give us more information. It's just like the media. They only tell us what we need to know at that time or what they want us to know, right? It's up to us as individuals to discern from all of that stuff that they tell us what's real and what's not. Just like in the beginning of COVID, when the United States couldn't get masks and PPE, I was there in New York with those people, the healthcare workers that couldn't get masks and PPE. I had to find a way to get stuff from China because there was nothing here, right? So we ordered equipment from China. We got our mask and PPE. But what did they say from the CDC? They said, okay, you don't have to have a medical mask. You don't have to have a K95. You don't have to have an N95. Leave those for the medical professionals, which is true. We should have done for the medical professionals, the KN95s and the N95s. But medical masks, the standard surgical masks, everybody should have those on. They should have never told the public that we can wear scarves, handkerchiefs, pull up your shirt, which means nothing.
What did Trump say? Trump said that we can put bleach in our veins. He said that we could put Clorox. Remember that?
I thought that was pretty hilarious. I mean, whoever watched that clip or whoever watched that segment, they saw, his advisors behind him when he said that. And his own advisors were like, why am I here? They were trying to hide. They were because they're medical professionals.
Right, but it goes to say, like, picking back off of what you said, like, what the politicians and what the media says to us, it's to our own discernment. Just like he said that, did people actually go and put Clorox in their veins and go drink some bleach? He said he didn't lose the presidency. People actually went and stormed the Capitol, and now they're saying that we should get vaccinated. Are there people that are not going to? Yes, people don't trust it because of the, conflicting information. And medical workers like yourself would say that it's science, and science changes every second, every minute, every year. So I guess we just have to be comfortable with change.
I mean, you don't really have a choice. I mean, everything in existence is change. Once upon a time, not too long ago, the world was flat.
Oh my gosh. Are you a flat earther? Is that what you're saying? Are you saying that?
I follow science.
Oh my gosh.
I follow science, so I understand that the world is not flat. But once upon a time, the world, everybody on the planet thought the earth was flat. Mm-hmm. Not too long ago, how many planets do we have? We had 9 planets. We don't have 9 planets anymore. We have 8. What happened to the 9th planet? It changed. It changed its designation. Once upon a time, electrons were the smallest particle. the smallest atomic particle. The electron is no longer the smallest atomic particle because we discovered something smaller. It changed. Everything is going to change. As we grow as human beings, we learn new things. So when you say, the vaccine, we don't know if it's 100% yet. I mean, that's your choice to wait for 100%, but none of the vaccines are 100%. Like,
Right. And I think the thing with COVID is that it spread so rapidly. And like you said, the hospitals were overflowing. There weren't enough healthcare workers to help everybody. And like you said, people were dying without even getting a chance to like fight for their life because nobody knew what it was, how to fight it, But now I feel like we're at a point where more than half of the country is vaccinated. So that's not enough control.
that's not what the scientists say.
Right, right.
To eradicate something and prevent it from mutating, you have to bring it down to a certain level that it cannot reproduce and change. So we need, they're saying upwards of 8%. We need 98% of the population to be vaccinated in order to eradicate something that's affecting us. If we don't get there, it's still going to be lingering around new things. So when you say, the vaccine, we don't know if it's 100% yet. I mean, that's your choice to wait for 100%, but none of the vaccines are 100%. Like,
right. And I think the thing with COVID is that it spread so rapidly. And like you said, the hospitals were overflowing. There weren't enough healthcare workers to help everybody. And like you said, people were dying without even getting a chance to like fight for their life because nobody knew what it was, how to fight it, But now I feel like we're at a point where more than half of the country is vaccinated. So that's not enough control.
that's not what the scientists say.
Right, right.
To eradicate something and prevent it from mutating, you have to bring it down to a certain level that it cannot reproduce and change. So we need, they're saying upwards of 8%. We need 98% of the population to be vaccinated in order to eradicate something that's affecting us. If we don't get there, it's still going to be lingering around and we're still going to have to wear masks. Right. So if everybody gets vaccinated, we can not wear masks. Wouldn't you want to go back to not wearing masks?
But that's not true though, because even when you are vaccinated, you can still contract, like get COVID, and you can still spread it.
That's true.
Because regardless, I feel like we're now in a state where if you want to protect yourself, you're going to wear a mask. If you want to protect yourself, you're going to use hand sanitizer. You're just going to be an overall more clean person. I guess that's the only up from this virus.
Right.
Is that now people are more clean and more cautious with their like personal areas.
I mean, in theory, we're supposed to be that way because of the situation, and we should be that way anyway. Like in China, they've been wearing masks for I won't say hundreds of years. They've been wearing masks for a long time.
But Michael Jackson was walking around with a mask.
That's something different. That's something different. But in China, they wore masks even if they had a cold, and not, to not spread it to other people, just out of respect for other people. But here, we're going to be stuck wearing masks for a long time because everybody's not vaccinated. We can't eradicate COVID without everybody being vaccinated. The same thing with measles, mumps, and rubella. It would still be circulating if they didn't mandate it to everybody. You can't go to school, you can't go to daycare, you can't go to high school, you can't go to college, you can't get a job because you have to have those vaccines. Same situation. We're getting there, but we're right in the beginning right now. It's a process we have to go through. It's just inevitable. It's what we do.
Thank you. Is there anything else that you wanted to share with us today?
Yes. A lot of my colleagues, healthcare workers, you hear about this in the news. People don't want to get vaccinated. Even the healthcare workers don't want to get vaccinated.
Right, and it's like they were on the front lines and they were working directly with people that had COVID, for a whole year without having the vaccine.
Mm-hmm, mm-hmm. And this comes from people's personal beliefs. They just don't want to be vaccinated. They don't want to take the chance of something happening with the vaccine. same thing everybody else is saying. Those healthcare workers are the same as everybody else in the population. They're no different. Why they're losing their jobs, however, is because it's their responsibility to take care of their patients, not put their patients in jeopardy. So an unvaccinated worker or unvaccinated healthcare worker or teacher puts the children in jeopardy. You can't have an unvaccinated teacher around children who have no choice. They don't have the choice of taking a vaccine or not because we don't have one for them. So you can't have a teacher in a class of 30 kids who could potentially spread their virus to all of those kids. Then all those kids go home to their families and spread it to their families. So that's why the vaccine is there for teachers. Same thing in hospitals and healthcare workers. You don't want to have patients going somewhere where they're supposed to be getting care, wind up getting sick. It doesn't work. That's not how the cycle is supposed to work. You're supposed to get better. You're not supposed to put yourself in danger, unnecessary
and ultimately,
danger.
And ultimately, it's keeping the economy flowing. As long as the kids are.
Now you're talking politics.
I'm saying it's the Genzone. We keep you awake and aware, political news.
And that's reality.
But, and it's all connected, as long as if the teachers are vaccinated, then they're keeping the children safe and the children can go to school, which means that, school is daycare for a lot of families. So if the children are at school, then the parents can go to work. And, it's a cycle that keeps the whole system flowing.
That's
so
100% correct.
I'm not even surprised. But I do have a question. Have you seen any of the videos circulating with the people who have put metal spoons or forks to where they were vaccinated and it sticks?
Yes, I've seen that.
So.
Did you have a question about that?
Yeah.
You want me to comment on that?
I want to know what you think. I mean, is it a magic trick that we can all learn?
I think if people want to give it credence or validity of any kind, yes, they got the vaccine, so now they're magnetized so they can stick metal to, okay, what about all of the, what is it? It's 4 million, no, I'm sorry. It's 6 billion vaccinations that have been given out all over the world. That means that anybody that got vaccinated can stick a piece of metal to their arm and it's going to stick.
Have you tried it?
No, I don't, no.
No, I haven't tried it either. No. But I just, I had to throw some humor in there.
Yeah, that's definitely humor. I mean, some of those conspiracy theories, they're just conspiracy theories. Most of them don't make any sense.
We have a